Social determinants of health for me are the places where people live, play, pray, work, and just basically have their lives as whole people. I think for me what's really important around the social determinants of health is that there's a difference and some commonality between the social determinants of health and the social determinants of equity, or the social determinants of health equity. So, I know in my neighborhood in particular, when bike lanes went in, members of my community said, that's just another example of gentrification. So what was intended to be a health promoting behavior ended up really creating a message of not belonging for people who are longtime residents, and that doesn't promote health. So I think what's really important, what's been really exciting about the work that Northwest Health Foundation and the Kaiser Permanente Community Fund have been doing is really looking at the intersection of the social determinants of health and the social determinants of health equity. And that means making sure, as we have these grand ideas, these visions about important policies for the city of Portland, for the metro area, for Oregon, for Washington, that the voices, the diversity in all voices is heard in policy making, the different experiences of people's lives, that where people occupy different places of power and privilege, that all those things are taken under consideration so that truly everybody can co-create a healthy community and benefit from it equally. We have to be really careful about our language and how we mean the words that we say. So when we do say we want health for all Oregonians, what does that mean? Does it mean a one-size-fits-all strategy? No. Does it mean all documented Oregonians? Really, it has to be broader than that. So I do think that's a really important example, and because there's so much energy right now in the state around health systems transformation, we don't want to get lost in the big vision of health care access and quality health care without remembering that there is a certain part of Oregon's population that's contributing in so many ways to the state but isn't included in that policy. So this is another example of how the social determinants of health can sometimes exclude the social determinants of health equity. And one thing as a longtime Oregonian that I was very excited about personally was the Portland's ordinance, which moved away from using plastic bags to paper bags, right? Paper bags are reusable, they're more sustainable, they don't fill up the landfill. But what I learned was that for transit-dependent Portlanders who are low income, often have lots of bags to carry, often have to wait for the bus, and in our city it's often raining, the impact of carrying paper bags on rainy days through many bus trips can create huge barriers for them to access food and to be able to take care of their family in a meaningful way. I also think that we haven't done a lot about talking about equity or assuring equity for lesbian, gay, bisexual, transgender Oregonians. We don't have data, really, that's very good on those communities and on the challenges that they experience across the health spectrum. And so, conversely, we're also not tapping into the strengths and the assets that they bring as communities. So I think that's another piece that's really important for us, to not be scared to move that forward and make sure that we're asking the question, whose perspective are we representing? Whose perspective needs to be brought to the table so that everyone has a seat at the table? And one thing that really stands out for me is the strength of Native American communities in Oregon who've been here documented for 10,000 years plus, right? Time immemorial. So when we talk about sustainability, who really should be leading that conversation but the community that's been here for over 10,000 years? Or when we talk about alternative medicine. For many communities, it's not alternative, it's what's sustained them for, again, thousands of years. So, in some cases we wait for science to catch up with the wisdom that people hold in their oral tradition, in their cultures, and so I think equity means that there's different ways of knowing, there's different ways of leading, there's different ways of running a meeting, there's different ways of responding to a grant, request for proposals. And so being able to step back, that's about power sharing. And I think sometimes that pushes people outside of their comfort zones and requires a level of trust or a leap of faith that often does also require courage.